Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine. Making sure there are enough well-trained healthcare professionals to care for growing populations is a major challenge in global health today. Dr. Wagaki Gicheru has spent much of her career focused on that issue and transforming how healthcare workers are educated and prepared to serve their communities. She's an anesthesiologist, a medical educator, and head of e-learning at the Kenya Medical Training College, an institution that trains the vast majority of Kenya's healthcare workforce. She recently served as the keynote speaker at our Global Health Education Day here at the Havey Institute at Northwestern University, where she talked about the importance of not only training more healthcare workers, but preparing them with the skills, technology, and support they need to deliver excellent care where it is needed. We welcome Dr. Wagaki Gicheru to the show today to talk about her career journey, which has transformed how healthcare professionals in Kenya are educated. Welcome.
Thank you, Rob. I'm delighted.
We're very happy to have you. My first question, what was your childhood like growing up in Kenya? And when did medicine first capture your imagination?
That's a very good question. I don't think I had an aha moment. It was sort of like you transition into the space. I was brought up in a family where my mother was a nurse and my father was also in healthcare, though he was a nuclear physicist. So I got to see medicine through their eyes. But I think it was also that unwritten rule that if you did well in sciences, you did medicine. So I went through high school doing sciences and I thought, okay, I should probably do medicine. But I think it made sense to me when I went into medical school. So that was my journey.
You shared that your mother was one of the first Kenyan nurses sent to the United Kingdom for advanced midwifery training before Kenya's independence. What was it like growing up with a trailblazer like her, and how did her example influence the kind of physician and person you wanted to become?
Thank you for that question. I think we take our parents for granted. We always see them through the lens of they're your parent who is maybe not doing the things that you'd like them to do. It's only when you become older that you actually understand their career pathway. So I saw my mom as a nurse. I used to wear her uniform because she'd hang it behind the door, and I'd like her cape and her hat. But I only got to know the journey that she took when I became a healthcare worker myself. Then I began to ask, how was it like being a student from a poor family? They identify you as a top student, and then you go on into high school, and then you do so well to be able to go to the university. And then she went on to be selected amongst the first nurses to be trained, to be able to come back into Kenya and either provide training or to lead the institutions when they were being turned over from the colonial government to the Kenyan government. So as I was growing up, I never saw her through that lens. I only saw that lens when I became a healthcare worker and started to think through my own journey and how I came to be a healthcare worker. I then asked the questions.
Well, it certainly made an impact in the end, that's for sure. You studied medicine and then later anesthesia at the University of Nairobi. Can you tell us why you went into anesthesia? I have to say, I don't interview too many anesthesiologists on this podcast. What was it about that specialty that appealed to you?
When I went for my internship, I went to a rural town and I spent a lot of time in the labor ward and in the obstetric unit. And as a result of that, also spent a lot of time doing cesarean sections. So as we're doing those cesarean sections, the thing that I saw was lagging behind was the anesthesia provision. So the surgery was emphasized for as interns and as medical officers. We had to learn surgical skills, but nobody told us anything about how to make sure that the patient is safe, is pain-free. I found that was something that was a major gap. So that was how I developed my interest in anesthesia.
Many physicians spend their entire careers caring for individual patients, but you eventually shifted towards educating thousands of healthcare professionals. Was there a defining moment when you realized your greatest impact might come from teaching rather than practicing medicine alone?
Yes. Even when I was a medical officer, I spent a lot of time teaching. I just didn't know that was something that was innately in me, the teaching aspect. I just thought every clinician teaches somebody because you always have to. You're being mentored and you're mentoring somebody else. Then somebody told me, would you be interested in working at Kenya Medical Training College? And I thought, I've not thought of entering education and doing education. And my approach to it was I will go there, but I will still be a clinician who is mentoring others, not really thinking about the education bit of it. And so I have now learned that health professions education is something that we really as clinicians need to understand so that we can be able to do it right. And I think I've found this to be what happens with most clinicians who are then asked to teach, is that we just teach based on what we have been trained to do, which is to mentor and to tell others what you know. We've never really known that there's a pedagogy to health professions education. So I've learned as I've gone along.
Well, I can see why you are lead speaker at Global Health Education Day here at Northwestern. It all fits together. Today, Kenya Medical Training College educates an extraordinary share of Kenya's healthcare workforce. When you joined the institution more than 2 decades ago, what was your vision then, and how has your role evolved?
My vision was very small. I was just only thinking about emergency care and anesthesia. So that's how I plugged in. I spent a lot of time teaching basic life support, advanced life support, even for staff and for lecturers. And so I was doing faculty training only for emergency skills. And then I also did a lot of curriculum review for anesthesia. When I joined, the anesthesia program was being provided. It was 1 year for the non-physician anesthesia providers. And so I looked at the curriculum and I thought, no, there's some gaps and there's some need to increase the training and increase the sites. So we moved it from 1 year to 18 months and we increased the number of sites providing those non-physician training. So I started off just doing what I knew. As I progressed, I started to learn other skills, which included the use of digital technology. And so then I switched to training faculty to do that.
Let's drill down into that area a little more. You are now the head of e-learning and coordinator of KMTC's simulation laboratory. How did simulation become such a passion for you? And what difference have you seen it make in how clinicians learn and ultimately care for patients?
My pathway towards simulation has only been 5 years. I started off by being exposed to it. So I was doing a lot of basic life support and advanced life support, where there was a little bit of simulation that we were doing. But I did not understand how to use it in a wider context until I got exposed to it. So I met a group of people who were doing simulation and I joined their program and then learned how to do it. Later went on to also do a training at a local university within Nairobi. And then I learned the pedagogy of it, then found a partner who was willing to set up a simulation center for us at KMTC. So we spent during COVID, many months casting a vision of what that could be like, locating an ideal place, and then setting it up and finally launching it in 2020. It's been a slow, steady path towards that end of actually doing simulation and having a center that we can utilize. So I've also attended trainings that have been offered by Northwestern. We work very closely with the Harvey Institute of Global Health through Dr. Colleen Fant and Professor Ashti. We've done a lot of faculty training. They've come to Nairobi. We've gone to Kisumu and trained especially anesthesia providers in the use of simulation.
Yeah, Dr. Ashti Dubey-Prasad is co-head of our Global Education Center. Dr. Fant is the co-director of the Global Pediatric Center. So 2 very important people at the Harvey Institute. You are also passionate about community-based innovations. One you have shared that I find really incredibly innovative is the recognizing that motorcycle taxi drivers, boda riders, are often the first people to respond to road accidents. So you and your colleagues at KMTC decided to train more than 11,000 of these drivers in basic life support and first response. I mean, I think this is just an incredible type of initiative that you did. Could you tell me more about this?
It was an interesting journey to that point. So we were trying to think about how we can engage in terms of emergency care in Kenya. But as an institution, we realized that we're not at service provision because we are a training institution. We don't have a hospital. We don't own ambulances. So we can't provide the service aspect of emergency care, but we are good at training. So when we looked at the strategic plan for the country, we thought, where can we plug in with training that would make significant impact? So we thought pre-hospital care. So we thought, okay, for pre-hospital care, what aspect? Then we thought possibly bystanders, because in Kenya, we don't have a very good network of ambulances. You have to call a specific ambulance to come and pick somebody who needs to be rescued wherever they are. So there's no 911 that you can call. So most of the times we respond as citizens, accident or a crisis. So we thought, okay, on the roadside, who are the people who respond the most? And we finally came to the conclusion, of course, there are other motorists also respond, but where do you find a motorist? But you can find a border because they've got associations, they park close to bus stops and markets, so we can find them. So that's how we came down to that bystander, because in Kenya, they are our fast responders. Well, they are our bystander responders that respond fast. Yeah.
That's incredible. What an innovative program. You've developed many partnerships around the world with institutions like Northwestern. Tell me about your work with our institute and what makes for truly equitable partnerships from your perspective in general.
I first met colleagues from Northwestern in 2023. So they had partnered with a university in Kenya called Maseno University, and they were doing a conference on health professions education. And so I was invited to come. When I saw the poster, I registered and I thought I'll go and do a presentation. So that was my first time to interact with Northwestern colleagues. And so what I found as we have continued to collaborate is that the collaboration is based on mutual respect. It's also based on mutual understanding of each other's role in global health and recognizing the part that each partner plays. So I've found that they have created together in Maseno and others, who created an environment where as health profession educators, we can come together and share ideas. The conferences, we don't have major ideas. I mean, there's probably no innovative thing, but I have found that it's a place where I can learn what somebody else is doing and they can learn what I am doing. And together we can partner to create this community of practice around health professions education. So I think it's provided like a safe space where people can be able to learn and share ideas.
It sounds like a win-win situation to me.
Yes, exactly.
As you look at your work today, what research or educational initiatives are you most excited about?
Education, I think it's one of those, at least in our institution, I have seen there is potential for growth, but yet we've not sort of tapped into it. And I think healthcare has moved on to using digital technologies a lot, even AI, but health professions education has lagged behind. And as we have grappled with how do we make our healthcare workers ready for the market, which is using technology, we've had to rethink how we teach so that they also begin to learn how to use technology. In our country, people use phones a lot, but especially as they're training, we don't have very high computer literacy. Even though some people do computer in high school, you can still see that it's just at a basic level. And yet the workplace requires that you have to be able to do more. You have to type, you have to use spreadsheets. So there's a gap, around digital literacy I'm more passionate about, and getting faculty and students to be ready for that market.
Many people think of global health as traveling abroad or working internationally. What does global health actually mean to you? And why do you think so many people are already doing it without even realizing it?
That's a very good question. Yeah, I can say that when somebody asks me, do you do global health? I hesitate first because I think, do I really? Because of that notion that it means that I've probably gone somewhere else and done something. It's not about what I am doing that helps provide solutions for many people across the different divides. In our country, health is devolved, which means that healthcare is different depending on where you're sitting within Kenya, which means it's a global health space. Even as we do our education, we have to do it in the context of which campus are you in? Are you in northern Kenya? Are you at the coast? Because what you're going to be exposed to in terms of healthcare provision will be very different. So we have to keep providing solutions and also enabling our faculty and our students to learn in a way that they don't feel that divide and difference, and yet they meet the local healthcare needs within the communities that they're living and training in. I think global health health is doing health in diverse settings, across whichever divides exist, whether it is socioeconomic or even geographical, and even if it is within a border.
That's a very astute interpretation of global health, I have to say. But I agree with you 100%. One last question. What advice do you have for young people who are just now embarking or wanting to embark on a career in global health? What advice do you give?
I would say just open your eyes, especially in the healthcare space. See what needs exist in your local community. That will begin to speak directly to you, and it will perhaps see what draws you. Some people are drawn to pediatric population. Answer that question. What draws me? What stirs me? What moves me? What's the thing that I'm immediately drawn to? That, I would say, would be the beginning point. From there, spend your time in that area learning more. And as you learn, you will begin to see perhaps things that trouble you or things that interest you. And then you begin to walk in that direction. I think also find somebody who's in global health to mentor you. I think they help you ask questions that are important, and perhaps they give you an opportunity to sit by them, learn. So find somebody in that space as well.
People interested in global health are meeting lots of people like you and others who joined me on this podcast and to get their perspectives. And I think it's incredibly helpful. Dr. Wagaki from Kenya, thank you very much for joining me today on the podcast. I really appreciate you taking the time to help us with our journey here.
Thank you for having me on this show.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes, and join our community that is dedicated to making a lasting positive impact on global health.